You're listening to NeuroScience News Reading, presented by Hakeem Ali-Bocas Alexander on the Wisdom app for World Reading Club in association with UniquilibriuM. This episode is titled Risk for Alzheimer's Increases by 50 to 80% in Older Adults Who Caught COVID-19. This reading is based on the article from NeuroScienceNews.com entitled Risk for Developing Alzheimer's Disease Increases by 50 to 80% in Older Adults Who Caught COVID-19 under the categories of Featured, Neurology, and Neuroscience from September 13th, 2022. Summary. The risk of developing Alzheimer's disease almost doubled in older people during the 1-year period following COVID-19 infection. Source: Case Western Reserve. Older people who were infected with COVID-19 show a substantially higher risk, as much as 50% to 80% higher than a control group, of developing Alzheimer's disease within a year, according to a study of more than 6 million patients 65 and older. In a study published today in the Journal of Alzheimer's Disease, researchers report that people 65 and older who contracted COVID-19 were more prone to developing Alzheimer's disease in the year following their COVID diagnosis. And the highest risk was observed in women at least 85 years old. The findings showed that the risk for developing Alzheimer's disease in older people nearly doubled, 0.35% to 0.68% over a 1-year period. So that's 35% and 60% respectively. Over a 1-year period following infection with COVID. So once again, the findings showed that the risk for developing Alzheimer's disease in older people nearly doubled, 35% to 65%. Oh, you know what? Am I reading this correctly? Nearly doubled. Yes. Okay, got it. That's the number doubled to. Nearly doubled, because it would have been 0.70 if it actually doubled. All right. I'm back on track. Nearly doubled, 0.35 to 0.68 over a 1-year period. All right. Following infection with COVID. The researchers say it is unclear whether COVID-19 triggers new development of Alzheimer's disease or accelerates its emergence. They use that word emergence. It sounds really scary. Alzheimer's disease is scary. NeuroScience News continues. The factors that play into the development of Alzheimer's disease have been poorly understood, but two pieces considered important are prior infections, especially viral infections, and inflammation, said Pamela Davis, distinguished university professor, and the Arlene H. and Curtis F. Garvin Research Professor at the Case Western Reserve School of Medicine, the study's co-author. Since infection with SARS-CoV-2 has been associated with central nervous system abnormalities, including inflammation, we wanted to test whether, even in the short term, COVID could lead to increased diagnoses, she said. The research team analyzed the anonymous electronic health records of 6.2 million adults 65 and older in the United States who received medical treatment between February 2020 and May 2021 and had no prior diagnosis of Alzheimer's disease. They then divided this population into two groups, or it should say into two groups. It says here they then divided this population Two groups, okay. They then divided this population into two groups, one composed of people who contracted COVID-19 during that period, and another with people who had no documented cases of COVID-19. More than 400,000 people were enrolled in the COVID study group, while 5.8 million were in the non-infected group. If this increase in new diagnoses of Alzheimer's disease is sustained, the wave of patients with a disease currently without a cure will be substantial and could further strain our long-term care resources, Davis said. Alzheimer's disease is a serious and challenging disease, and we thought we had turned some of the tide on it by reducing general risk factors such as hypertension. Alzheimer's disease is a serious and challenging disease, and we thought we had turned some of the tide on it by reducing general risk factors such as hypertension, heart disease, obesity, and a sedentary lifestyle. NeuroScience News continues. Now, so many people in the U.S. have had COVID, and the long-term consequences of COVID are still emerging. It is important to continue to monitor the impact of this disease on future disability. Rong Xu, the study's corresponding author, professor of biomedical informatics at the School of Medicine and director of the Center for AI in Drug Discovery, said the team plans to continue studying the effects of COVID-19 on Alzheimer's disease and other neurodegenerative disorders, especially which subpopulations may be more vulnerable, and the potential to repurpose FDA-approved drugs to treat COVID's long-term effects. Previous COVID-related studies led by CWRU have found that people with dementia are twice as likely to contract COVID. Those with substance abuse disorders are more likely to contract COVID, and that 5% of people who took Paxlovid for treatment of COVID symptoms experienced rebound infections within a month. NeuroScience News suggests you see also, under the suggested titles of Featured in Neuroscience from July 9th, 2022, Study examines memory in birdwatchers. Finds having expert knowledge helps us memorize new information. NeuroScience News continues. About this, aging, COVID-19, and Alzheimer's disease research news. Author, Megan Hahn. Source, Case Western Reserve. Contact, Megan Hahn, Case Western Reserve. Image, the image is in the public domain. Original research, open access. Association of COVID-19 with New Onset Alzheimer's Disease by Pamela Davis and others. Journal of Alzheimer's Disease. All right. You're listening to NeuroScience News Reading, presented by Hakeem Ali-Bocas Alexander on the Wisdom app for World Reading Club in association with UniquilibriuM. NeuroScience News continues with an abstract from Association of COVID-19 with New Onset Alzheimer's Disease. An infectious etiology of Alzheimer's disease has been postulated for decades. It remains unknown whether SARS-CoV-2 viral infection is associated with increased risk for Alzheimer's disease. In this retrospective cohort study of 6,245,282 older adults aged older than 65 years or older who had medical encounters between February 2020 and May 2021, we show that people with COVID-19 were at significantly increased risk for new diagnosis of Alzheimer's disease within 360 days after the initial COVID-19 diagnosis. Hazard ratio, or HR, 1.69, 95%. CL, 1.53 to 1.72, especially in people 85 years and of age and older, and in women. I don't understand the hazard ratio numbers, so we'll have to do some other research for those. Our neuroscience news continues. Our findings call for research to understand the underlying mechanisms and for continuous surveillance of long-term impacts of COVID-19 on Alzheimer's disease. Neuroscience News asks you to join our newsletter. Sign up to receive our recent neuroscience headlines and summaries sent to your email once a day, totally free. We hate spam and only use your email to contact you about newsletters. You can cancel your subscription anytime. Neuroscience News posts science research news from labs, universities, hospitals, and news departments around the world. Science articles can cover neuroscience, psychology, AI, robotics, neurology, brain cancer, mental health, machine learning, autism, Parkinson's, Alzheimer's, brain research, depression, and other topics related to cognitive sciences. You've been listening to NeuroScience News Reading presented by Hakeem Ali-Bocas Alexander on the Wisdom app for World Reading Club in association with UniquilibriuM.